5.8 million Americans currently living with Alzheimer's disease, and that number is expected to grow. The new information from the Alzheimer's Association suggests that people might not be getting the tests that could help them with early detection. And with us today is Dr. Joanne Pike, and she's the Chief Program Officer at the Alzheimer's Association. Thank you so much for joining us today. And if you could tell us, what are some of the key findings for 2019?
It's great to be with you today. Some of the key findings for 2019 is that there are 5.8 million Americans living with Alzheimer's today. That number is expected to grow to 14 million by 2050. In addition to that, there are over 16 million Americans that are serving as caregivers, providing 18.5 billion hours of unpaid care.
And how is Alzheimer's affecting Florida residents?
In Florida, there are 560,000 individuals living with Alzheimer's, and those numbers are expected to increase 28.6% by 2025, just 6 years from now, unless a new treatment is advanced through research and other science.
So the report talks about cognitive assessments. Can you tell us what are they? Why are they so important?
A brief cognitive assessment is really the interaction between a primary care provider and a patient that happens on an annual basis, preferably during the annual wellness visit that's provided by Medicare. It's a simple series of either questions or a standardized test. It could be a matter of the physician asking a patient, have you noticed any changes in your memory or thinking? Or it could be the patient bringing up questions or concerns. However, it could also be using an informant or a caregiver there to ask them if they have noticed any changes.
How can doctors and patients really be in sync during their routine checkups?
One of the things that we found in our survey is that physicians and seniors both believe that cognitive assessment is an important part of the annual wellness visit or during routine checkups. However, what we're finding is that 50% of seniors are receiving these brief cognitive assessments, and only 1 in 7 are receiving it on an annual or a routine basis. In order for physicians and seniors really to come together and be much more proactive about this conversation, we believe that it takes both sides. The physician to be more proactive about having these conversations, but also if a senior has a question or a concern or they notice their own changes, to be able to have that conversation with their provider.
So let's say our viewers have, they might be experiencing some memory or thinking issues, or maybe their family members. What are some resources and what's available to them?
If someone is noticing any changes in their memory or thinking, or if they notice something in their family member or a friend, they should be discussing this first with their primary care provider. That is the most important conversation that someone could be having if they're noticing a change. If anybody has questions about how to access resources, or if you would like a checklist on how to have that conversation with your provider, please visit us at alz.org.
Thank you so much for your time and that information, Dr. Pike. And we all will share this information with you on our website at